Well, we enlisted the help of our dear friend and colleague, board-certified OBGYN here in Los Angeles, Dr. Aliabadi. Welcome back to the show.
Hi.
Thank you for having me.
So when you first saw Michelle, what did you think was going on?
As soon as I saw her, after taking a good history, I did a complete physical exam. Her physical exam was normal. She did have tenderness and pain in her left lower quadrant. I did send her for an ultrasound of her left inguinal area to rule out a hernia because, like I said, she had tenderness in that area, and that's one of the things you have to rule out. Once I ruled that out, and she was still complaining of pain, I did a pelvic MRI. So in Michelle's case, I've ruled everything out, and the only thing left right now that I suspect, and I had suspected from the beginning, was that she probably had adhesions from her prior surgery. She had surgery on her left ovary, and that's exactly where her pain and tenderness is. A lot of patients after surgery, especially abdominal or pelvic surgery, develop adhesions, and these adhesions can start a few days after surgery and they can progress. And eventually they can pull and cause pain. They can pull and put pressure on different organs. Because we've ruled out everything else in her case, the only thing left is to do a quick outpatient laparoscopic surgery. We make tiny incisions and we put a camera to the belly button and we look, and I'll be able to see if she has any adhesions. And usually when we cut those adhesions, their pain is immediately resolved.
These type of post-surgical adhesions in and around the female reproductive tract is quite common, correct?
They're very common, and you have to remember endometriosis can cause adhesions without having a history of pelvic surgery. So that's why I think the most important message is to remember that any type of chronic pain is not normal. Painful periods are not normal, and any type of pain should be worked up.
So what's next for Michelle, Dr. Aliabadi?
So the next thing is to basically make sure we find a time that works for her. And like I said, the procedure is very quick. It's straightforward. It really doesn't have downtime because the incisions are very small. So if she can take it 2-3 days off, I'll be able to look inside and hopefully fix her pain.
Michelle, how does that make you feel hearing you need surgery?
A little bit apprehensive, but it's also nice to know that there's light at the end of the tunnel and that potentially what I'm experiencing will go away and I can be normal.
That's the right thing to do, Michelle. You're in the best of hands. You know we love you. Thank you, Michelle and Dr. Aliabadi, for being here. It's a great, important topic for a lot of women out there.
Thank you for having me.
Thank you so much.